wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. It's going to be a very interesting program because I'm interviewing two sisters all the way from the Seattle area of Washington State, Mandy and Macy O'Hara. And they have got two really remarkable stories. Now, normally when you think of Hotze Health and Wellness Center, you think of women coming in midlife in their late 30s, 40s, and 50s. But these two young ladies came in at a much younger age, and they're attending college in Washington right now. And I want to introduce them to you one at a time. First, Mandy, thank you for joining us today.
Thank you for having me.
And Macy, thank you for joining us today.
Thank you so much for having us.
You bet. Now, Mandy came in originally in July of 2025. Her sister followed in November of 2025. So let's back up to 2025 and before. Mandy, tell us about what was going on in your life health-wise, and how in the world did you end up all the way from Seattle, Washington, down here to the Hotze Health and Wellness Center in Houston, Texas?
Yes. So back in 2019, I came down with an illness, didn't really know what it was. I was in bed, I would go to school, and as soon as lunch would hit, I would pretty much be dead on my feet. And we kind of thought it was food allergies because as soon as lunch would hit, I would just crash out for the rest of the day. No energy, nausea, fatigue, joint pain. I felt like I had the flu 24/7. And so my mom was very worried about me and took me to a gastro doctor. And we went through all the process of 2 gastro doctors, an allergist. I got thrown antidepressants, anxiety meds, anti-acids, and nothing would work. And in 2021, after being sick for 3 years, our pastor's wife handed us your book. And she had a friend that had success with you guys, and my mom read it, and the Lord told her, go to Hotze. And in 2021, I walked through your door in October, and the rest is history.
You came in, when did you come in? When was the first visit? 21?
Yes.
Okay,
October
good.
21. I was 16.
Wow. You're the same age Macy is now coming in.
Same age Mandy is now.
This, and both of y'all had very similar presentations. So when you were seeing the conventional doctors and you saw numerous doctors, and then they started to put you on psychotropic drugs, antidepressants, anti-anxiety medication, how did that make you feel about yourself?
I had really low self-worth, super bad anxiety and depression because of the sickness. I saw, being 14, I saw other kids my own age being able to do things that I couldn't do, and playing volleyball, doing the sports. And we had a little church school, and my mom was the teacher, and she would just have me go. It was in the basement of the church. She would just have me go to the church and lay on the pew and take a nap while my friends were out playing. And I just I didn't feel like I was worth anything, and the depression was bad. And I think that's what the doctors focus on. They're just like, this is a kid with depression and anxiety, and threw some antidepressants at me, which made me way more sick than I actually was. I was on Celexa for a while, and I was so sick with that. And it just made me, I didn't feel like a human.
Now, this all started when you were about 14 years of age. Had you just started having your menstrual cycles going, entering puberty at that time?
Yes.
So this is not an uncommon presentation with young girls. And oftentimes did you notice, since this happened about that time you were entering puberty, were you having any irregularity in your cycles, and were you having any moods swings associated with your menstrual periods before or after?
Yes. So I had a couple menstrual cycles, and then I didn't have a menstrual cycle for like 2 years.
Ah.
When I became sick, food started bugging me, and I got down to where I was just eating meat, and I dropped down to 108 pounds. I was 5'9".
Wow. You were skin and bones.
It was just kind of shutting down. And so no menstrual cycle, no mood, actually, just a flat affect, no emotion. I didn't really laugh. I didn't cry. Definitely didn't cry. Just no emotions.
Okay, so your mama had a friend who found our book, Hormones, Health, and Happiness,
Yes.
at a used bookstore, someplace like that, and read it and gave it to your mom.
Yes.
So she must have been a friend of your mom and knew that you were going through some health problems at that time and recommended it to her. So your mom read the book, and she said, I guess she had to have called down here to see if we would take young women your age group, and they said we would. And so you came down, originally you came down in
October, November of 2021.
2021, okay.
Years
so
old.
That's been almost 5 years now.
Yes.
So when you came into the office, tell me what your impression was. Who did you see first?
So the doctor at that time was Angela. She was working at that time, and she was my doctor. And then I switched over to Jason, and then Debbie now. But each one of them were great and walked me through my process of healing.
And so I know that they recommended some change in your eating habits and treatment for yeast. They recommended some, I think you started on allergy treatment at the time too, didn't you?
Yes.
LDI, low-dose immunotherapy. Plus, we started to balance out your female hormones with natural progesterone.
Yes.
And then you took some vitamins and minerals. Now, once you got on the progesterone, did your periods and cycles normalize?
Yes.
So,
yes.
So you're very far now. Had you gone to see an gynecologist or OB-GYN doctor or family doctor who had recommended, anybody ever recommend birth control pills for you?
Yes, they did. I had never seen a gynecologist. I was just seeing my primary physician at the time. I was 16. And I think that sometimes it can be kind of normalized for people to struggle with their menstrual cycle at a young age. And me and Mandy both actually have really struggled at going through puberty and stuff and having regular menstrual cycles. So I think that they just, I was really low weight. They attributed it to my extreme weight loss.
Right. So what usually happens when young women like you have menstrual irregularities, they'll go see their gynecologist or their family practitioner, usually family practitioner, they throw them on birth control pills. So we'll just regulate your cycles with birth control pills. But birth control pills are not natural hormones. They're not the natural hormones that your body would normally be making in adequate amounts and balancing out. And that's the estrogen hormones and the progesterone. In a woman's menstrual cycle, which routinely is 28 days long, not the period, but the cycle, she'll have a period when you're younger, normally for 3 to 5 days, and there'll be some premenstrual symptoms that may occur, mood swings, fluid, weight gain, maybe headaches, breast tenderness that can accompany premenstrual symptoms, have a period, and then on day 14, a woman will ovulate, and when you ovulate, you give off the egg, and there in that area where the egg was came from in the ovary is called the corpus luteum, and you produce progesterone, which balances out the estrogen. And what you obviously weren't having, you apparently weren't ovulating, and you weren't having any periods. So, and it's very much. I have one of my daughters, my youngest daughter, when she was in college. My bride told me, she goes, Deborah isn't having any periods. She hadn't had periods for 2 years. I said, for crying out loud, why didn't you tell me this is what we do for a living, is balance them out? And she was in college, hadn't had a period for 2 years. We got her up on her natural progesterone. Now she has 4 kids, and she's done fine, and everything's well, and she's in her 40s now and has had a wonderful life. So balancing out the hormones is very, very important. And the reasons that there's many chemicals in the environment that we're all exposed to in the food we eat, the water we drink, the air we breathe. There's a lot of toxic chemicals that are based on petrochemicals, and they're xenoestrogens, and they adversely affect the way women and men produce their hormones, and they can lead to infertility problems and dysfunctional uterine bleeding and or total not having periods at all. So that's why it's important for you and others that have these problems not to try to counter them using counterfeit hormones and counterfeit drugs, but go back to the natural hormones your body should be making in natural amounts and begin taking those, and then it balances things out. So you came in November of 21. How long did it take you before you started feeling improved?
2 weeks.
2 weeks?
Yeah, my dad, one morning I woke up and my dad looked at me and he said, "You're a different girl." And I was noticing improved energy within 2 weeks.
Well, that's really remarkable. You've been seeing conventional doctors since you were 14 and back in 16, and now all of a sudden within 2 weeks you fly down to Houston and we put you on natural bioidentical hormones, clean up your eating program, get you on some allergy treatment, and get you on some vitamins and minerals, and within 2 weeks you're starting to feel improved. Now, that goes back to 21. How are you doing now?
I'm doing great. I just finished up nursing school, and I'm going for another round of nursing school, my LPN to RN bridge program. I moved halfway across the country a couple months ago and went to Bible college for a semester, and I'm doing incredible.
Well, that is incredible. Where'd you go to Bible college?
Illinois.
Well, that's great. Well, good for you. Well, you're getting mentally strong in your nursing training, and spiritually strong in your Bible training, and I commend you for that. That's wonderful.
Yes.
Okay, so now do you have any other brothers and sisters?
We have one older sister.
I got you. And she didn't have these problems?
Not as bad. She actually visited you guys in probably 2023. She took a trip down to Texas and visited y'all's office, but more to help with hormones.
Right.
She didn't Hashimoto's like we do.
Good. So tell us your story.
So around 2024, my family was planning a trip to go to a youth camp that summer, and I talked to my mom about it, and I was like, I'm kind of worried about going to this youth camp because I know there's a lot of activities that you have to participate in, and just it's a lot of going, a lot of energy you have to use. And I told my mom, I was like, I don't know if I can do that. I don't know if I can go. And I had been noticing this kind of lack of energy for the past year or so, but I hadn't really brought it up to my mom and really mentioned it. And so when I brought it up to her that time, she decided to take me to a doctor and to try to figure out what was going on. And we did some blood tests and nothing came up. My blood test came back perfectly fine. The doctors did say they found a couple of antibodies, thyroid antibodies, but it wasn't that severe enough to treat or do anything. So we just kind of pushed it off to the side and kept going, but I still struggled with energy, brain fog. I had the same things as Macy, like joint pain, depression, fatigue. And then about the beginning of 2025, I started noticing that I was getting food sensitivities. And they would
I'm sorry, you noticed what?
I was getting food sensitivities.
Okay.
And they would affect me to the point where I was so tired and couldn't function. And they just kept getting worse to where I was so fatigued I couldn't get just the daily things done. And around September, I got an allergy test. And when that came back, it said I was allergic to almost everything. And so at that point, my mom was like, we're taking you to Hotze.
And so here you come.
Yep.
And you came down and you saw Debbie Yannick, our nurse practitioner.
Yes.
And basically, you had your symptoms were very similar, and the cause of your symptoms were very similar. So we started you on some natural hormones. Were you having some of the same menstrual irregularities as far as premenstrual symptoms and mood swings and missing cycles like your sister had?
Yep. And the same thing that kind of happened to Macy, we would talk to my doctor about it, and they would just kind of blame it on either I wasn't old enough yet. They said maybe it'll eventually just balance out as you get older. I had lost quite a bit of weight, and so they said it could be attributed to your weight loss. And so they never really did anything about it.
Well, we're glad you came down. And so how was your visit with our nurse practitioner, Debbie Yannick?
It was very good, very different from other doctors. I felt like they listened to my symptoms and not just looked at my labs and brushed me off. I felt like they really listened and cared about my symptoms.
And so you've been up on the program now since when did you come in? You came in November?
Yes.
So you've been up on the program about 3 months, maybe 3.5 months. How are you doing? Are you making any improvement at all?
Yes, lots of improvement.
Well, that's great. And you're in college now.
Yes, yep. This is my first year of college and a full college workload, and am able to work and have all the energy to be able to do it, which I did not have before.
Well, that's tremendous. And Mandy did very well. Now she's going into a nursing program. What is your interest?
I am working towards my teaching degree.
Good for you. Well, we need some good teachers, Christian teachers, particularly in our country today. Well, this is just really a remarkable story, and I think it's very illustrative for our listening audience to know that, ladies and gentlemen, you have young daughters that are experiencing hormonal declines and imbalances that adversely impact their lives. And what they need to do is they need to have their hormones properly balanced with natural bioidentical hormones that are identical to what the body was making or should be making in adequate amounts. And that's what we do here at the Hotze Health Wellness Center. We treat not only for hormonal imbalances in women, but also declines in men. We also treat with natural thyroid hormone to help increase metabolism when it's indicated. We use a good healthy eating program, clean up the gut, get a good microbiome in your gut, good normal probiotics so we have good healthy bacteria in our bodies, vitamins and minerals, and then exercise program. And these two young ladies took charge of their health, and their parents made an investment in their health, and it made a huge difference in their life. Let me ask you two ladies, where do you think you would be now if you hadn't have come down here and gotten on the program?
I'd still be in bed, wasting away. But I wouldn't have made it through nursing school. Absolutely not. And I wouldn't have been able to go to college, Bible college, and have the friends that I do. I think the most amazing thing about this is my emotions. And I kind of proved to myself through nursing school and through Bible college, like I made so many friends, and life is so full of joy since I'm better now.
I would say probably the same thing. I'd still be in bed, just very low energy, and not being able to do college, working, and just being able to have fun with friends. Before, I felt like I couldn't be a kid, but now I feel like I can have fun and have those same emotions and have fun with my friends.
Well, this points to the power of our natural God-given hormones. When they become imbalanced or we're not producing them right, we don't function well. The hormones affect every cell in your body, including your brain cells. It's what helps you think clearly and feel well and feel good about yourself. And if the hormones aren't there, you're going to feel like you're going to feel at the age of 16 or 21 like you're a 60 or 70-year-old woman without any hormones. That's what happens when they lose their hormones, and that's why we always replenish hormones as women go through the change of life. We keep them on their hormones so they stay rejuvenated and young and vibrant. And I'm so glad that you gave us the opportunity to serve you, but I'm most proud of you two ladies because you took charge of your health, and I'm proud of your parents that they were willing to make that investment in your health. Kudos to your family. And your lives are going to be dramatically different because you took this pathway that is less traveled. Most people go into the doctors and they get on the antidepressants and anti-anxiety drugs and sleep medication and pain medication, and they're on that the rest of their lives and they feel terrible. You all are going to have wonderful, productive lives, and I pray God uses you in a mighty way in the lives of your family and friends and church members to advance His kingdom and advance the person of Christ in every way. I'm so proud of you two. God bless you.
Thank you.
Thanks for joining us today on our program. God bless you, young ladies.
Physicians Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.